I am super excited about this next panel, and I was so excited to be part of the pandemic simulation exercise that happened on Sunday. And we're going to call up all of the students who are here representing their groups. But first, I just want to thank them and give them a huge round of applause as they come up to the stage for being willing to spend their Sunday doing this. And also for what was absolutely an amazing afternoon. To kick us off, while we're getting set up, we're going to have Jason Moats, known to all of you here, who's going to give you a very short overview of what we actually did on Sunday and what was involved in the exercise. And then you're going to hear from each of our student groups about what they did, what they found. I'm going to ask them a couple of probing questions. We're going to have some group conversation, and then we'll leave hopefully a few minutes at the end for your questions on their perspectives. So without further ado, Jason.
Thanks. Howdy. So we started this off, and there were a lot of folks that helped put this together, including the help from the Smithsonian Institution and Dr. Parker and our 5 mentors. So what we did was we gathered the students around, and you'll see in just a couple moments that there was a lot of diversity in the group in terms of knowledge and where they came from and their experience levels. And that made this very exciting. So we started off with some objectives and basically gave them this scenario. We started with that in August of 2018, strange coincidence, that we started to see a lot of birds dying in China. And this was on the eastern edge of China, just north of Shanghai. And so we talked a little bit about the Jiangsu province, which is very large in terms of population. Over 79 million people live there. And the capital city, Nanjing, has just a little over 9 million. So it's very dense and just north of Shanghai, as we said. But it also has a very rural population in certain parts, and most of those folks live below the poverty line. So, and we talked a little bit about wet markets and the prevalence of wet markets in Nanjing in particular, and what that really meant and how that goes. And you can see from the inset, which looks kind of blurry, I'm guessing, from where you're sitting. But that's actually a scooter with about 9 cages of live birds on it, and that's pretty commonplace all over this province. So we went on and talked a little bit about how the scenario evolved, and it turned out to be H7N9. And we made the caveat and told them, while things may appear to be reality, this is all notional, and I want to make sure everybody understands this is all make-believe. So if you're tweeting on that, please don't do it. So we talked about that, and then we started to see some linkages with human cases popping up from people that had close contact with the birds. And then we talked a little bit about some of the things that were happening from the Minister of Health that ordered some culling to take place, and also enhanced biosecurity and biosurveillance things to be put in place, not only with the bird population, but also with cattle and swine, or poultry and swine and wildlife. And then we talked again about this explosive growth that's taking place over the province, and what we're seeing and how difficult it really can be to try to control this. And so we got into this, and we ended with this kind of ominous statement of it's the perfect storm conditions. And so that kind of got us up to where we gave the first inject, and that inject was, it's in China, it's in Nanjing. We have seen it in 3 commercial flocks in Shanghai, so fairly large flocks. And from that point, we handed off to the students where they were divided into 5 groups. And I'll hand it over to Beth and let her talk about that.
Great. Thank you very much. Thanks, and just to reiterate, this was intended to be a realistic simulation, but not something that is actually happened. However, it is obviously very clear that a situation that we've been speaking about for the last couple of days that many of us are worried about, a pandemic influenza coming from a real strain that we heard from our colleague at China CDC yesterday, is a real concern for countries around the world. So this is very much a scenario that we are all here to try to actually prevent the worst outcomes from happening. So the students were divided into 5 groups, and I'm going to let them each introduce and talk about what they learned and their full name of their groups. But the groups were, by and large, Jennifer is representing the U.S. government. We have Madison, who is representing non-governmental organizations and foundations. We have Thomas, who's representing the bilateral governmental community and implementing organizations. We have Edward, who is representing the government of China and its associated ministries. And then finally, we have Tess, representing international financial and multilateral organizations. So most, if not all, of the main components that would be called upon to handle an outbreak. And so I'm going to go ahead and start with group 1. Which one of you is number 1? Just because that might be the order our slides are in. So Tess, would you like to come up? I don't know if it works best sitting or if you prefer to come up to the podium and provide an overview of what you found, what your group found. And I think one of the main questions that everyone was called upon to answer in the end is one that one of my bosses, former U.S. Senator Sam Nunn, constantly asks us, which is, looking at a catastrophe, what do you wish that you could have done to prevent the catastrophic outcome? On the day after the catastrophe, what do you wish that you would have done to prevent getting to that situation? We were very much all challenged, including myself as a mentor in the scenario, to think about those outcomes. So welcome, Tess.
Thank you. Can you hear me? You can hear me? Okay, perfect. So as Beth said, my name's Tess Comerick. I'm a second lieutenant in the U.S. Air Force. I'm originally from Minnesota, went to undergrad at Emory University in Atlanta, served as a Peace Corps volunteer in Senegal and West Africa from 2014 to 2016, and now I'm at Uniformed Services University in my second year as a medical student. If we could advance the slide. So just to give you a little background of our group, we were made of emergency management, veterinary, PhD, kind of more hard science. So being in the role of an international financial institution or multilateral organizations was very much outside of our comfort zone. So for that, Texas A&M, I thank you for pushing us to kind of figure out what exactly our role was. And we had Dr. Brett Major as a guide to kind of tell us, okay, you're moving a little bit more into too much hard science, try to back it up and focus a little bit more on a broader view. Next slide, please. For this presentation, we were told to kind of divvy out what we learned in the realms of prevention, detection, and response. So from the prevention side, we saw our role as facilitating member states' cooperation. As WHO or IMF or those sorts of organizations, we can only provide recommendations. We don't have overt authority to tell organizations or member states what they are supposed to do, but only what we recommend. And so facilitating cooperation and collaboration we saw as integral to our role in a pandemic response. In addition to that, ensuring that partner states are sharing their information and their technologies that they develop in order to prevent outbreak of disease. And finally, establishing multidisciplinary teams to encourage positive health behaviors within local culture. So bringing in people that you don't traditionally think of in a health response, like cultural anthropologists, or involving community and religious leaders to make sure that whatever response or prevention measures you're putting out is being done in a culturally competent way that fits within the local culture. So moving on to detection. Again, we talked about information and resource sharing is key to detecting disease in a response, as well as doing active surveillance to kind of keep down the numbers and prevent further spread of a disease. And additionally, measuring tools to track pandemic progression, like incidents or trends, or similar to the National Electronic Disease Surveillance System, as well as scientific discovery, and overall, again, bringing collaborators to the table to share what they've learned and best practices that can be applied to other situations. And then finally, moving on to our response. Again, establishing a emergency management system, similar to EOC and what we see in pandemic outbreaks. Again, bringing our collaborators and member states together. And we also realize that poultry is a very integral piece of the Chinese economy, and so encouraging incentives to our implementing partners for reporting of disease within individuals as well as their flocks or potentially swine is important, because what we saw in the scenarios, there was underreporting, because when you're reporting something that's going to negatively impact your economy, you're less likely to do so. And so finding a way to incentivize individuals to do so is important in an outbreak scenario. And as well as we talked about providing economic impact projections for affected industries, so that member states and organizations understand the impact of what is going to happen in the event that they don't take responsibility for the situation at hand. And then finally, we were tasked with, what do you wish you would have known prior to beginning this exercise or beginning the pandemic? And we had a lot of different things that I'm sure will be echoed by my colleagues up here, but just to give you a couple that we thought were very important, is ensuring that there are existing plans, and Beth mentioned this a little bit yesterday with playbooks on different areas that may be affected, how that specific sector should respond in a given situation. We talked a little bit about less reliance on larger government, and as you can see up here, one of my colleagues put that pandemic response is locally executed, state managed, federally supported, and internationally collaborated. And so focusing more on local infrastructure is important, because that's where the response is going to take place ultimately. And then finally, I'd like to echo what the commissioner said this morning, in that behavior change is a really key factor of pandemic response. Yesterday we heard a little bit about how we need to educate the public a little bit more, especially with talks about complacency with the flu vaccine. But as my time as a Peace Corps volunteer, how we see the flu in the US is very similar to how my village saw malaria. And so understanding why people do the things that they do, and they may not do something that you want them to do because you want them to do it, but figuring out why they choose a particular behavior and harnessing that to get them to do the positive health behavior that you ultimately want. And so I think education is important, but I think there also needs to be an added focus on behavior change to ultimately understand why people do the things that they do.
Great, thank you very much. First, I want to give you a round of applause for a fantastic summary of what was a really complex challenge. And I think your group had one of the most complex challenges, because you weren't defined as a specific group. You had the financial institutions as well as the multilaterals like WHO, FAO, and OIE. And so I think I would have had a challenging time in your shoes. I'm going to ask each of our panelists one question before we move on to the next, and I'm going to ask you all the same question. And so Tassie, you're my experimental group, and the rest of you will be the control group, because I didn't tell them what the question was. It's a little bit of a softball, but I think it would be very interesting to me and hopefully to the audience. What surprised you in this scenario? What did you learn, either something that you thought existed for pandemic response that did not exist, or something that you wish that that was in place in the international or national system to be able to do a better job?
Sure. I think our group was surprised by the lack of authority that we as a multilateral organization or international financial institution had. Our primary responsibility was to provide recommendations and say, hey, you should do this because it's really important for X, Y, and Z reasons. But ultimately, we can say, economic projections will tell you that this will happen or that'll happen, but the lack of authority in being able to say, okay, we're going to do this was difficult for us to kind of manage in this scenario.
Yeah, for sure. Thanks again. I want to welcome our representative from Group 2, which was the government of China. Edward, the floor is yours.
Howdy, everybody. My name is Edward Davila. I'm a first-year doctoral student at the College of Veterinary Medicine and Biomedical Sciences. I also received my MPH from the School of Public Health here. My background is in epidemiology. I spent a couple of years as an epidemiologist for the city of Houston. So coming into this simulation and having to view it from a policy standpoint was very interesting. I definitely came in with a kind of like deer in the headlights type look because I'm used to being the boots on the ground, and it forced me to really change the way I see kind of promoting and acting on public health from what I'm used to. So our first slide in terms of prevention, we know that it was an avian strain of influenza, so we wanted to start off by beginning to cull herds of birds. And to do that, we would offer compensation to those farmers because not everybody, not all farms are big productions. You know, there are small-time farms that aren't necessarily able to rebound in the event that the state starts mandating the reduction of the herd. So compensation, I think, is pretty imperative there to get cooperation from the people. Also, we wanted to, I guess, kind of referring back to the talk this morning from the commissioner, kind of implementing some 1918 style prevention tactics by really suspending state-led events and ceremonies. We really wanted to limit the amount of large gatherings that were going to be occurring in the state, since you know the influenza spreads very easily, very quickly, and we thought that would be a good way to limit that. Another way that we wanted to help prevent the spread was to offer masks and respirators to the country, seeing as how a lot of products are Chinese made. We figured that we would have the resources available, maybe not to cover everybody, but at least to cover a large portion of the population that wasn't sick, or if they were sick, you know, to at least help prevent that spread. And then ultimately just initiate a very large hygiene education campaign. We'd like to think that everybody knows the importance of washing hands and covering your sneezes and not being around other people when you're sick or symptomatic. But in a time like this, it really needs driving home. So getting that in everybody's faces constantly and often really helps reinforce that behavior, behavior being an important factor in this simulation. If we could, in detection, we wanted to just begin active surveillance. So we wanted to send state officials, state representatives to the farms and to these families to kind of assess the situation and begin taking samples from both avian sources and human sources alike to see whether we could isolate the sample, maybe characterize the virus. Because in this simulation, you know, we thought we had a vaccine, but it obviously didn't work. So finding a one that is useful, that can actually help prevent this strain that is going through the population, is pretty imperative. And our response, just to kind of go back to how I ended the last segment, finding the vaccine is very important. So once we've characterized, sequenced that virus, do we have the vaccine available? If we don't, who does? If no one does, who can we talk to begin research and potential production of a vaccine? And that takes, you know, the assessment of our own resources, of our vaccine production and distribution capabilities as a country. Vaccinations, just on a mass scale, once we do have a vaccine, we want to start getting vaccinations to people to help give them an added protection. At this point, we don't know how far spread the virus has been, so the more people that we can vaccinate, the better, and we want to target high-risk groups that are first. So I think in the simulation we said that young adults were disproportionately affected by the virus, so we want to really target that demographic, and also nurses, doctors, those people that are on the front lines treating those that are affected, we want to get them the vaccine as well. In addition to that, we wanted to open additional treatment centers because in terms of a pandemic, you're going to have a lot of people that are sick, and it's probably going to surpass the country's capability to treat everyone. So those additional centers will become very important once the pandemic really starts going. And then lastly, hopefully it's not last, but you really want to identify the resources and the stockpiles of supplies that the country has and begin distributing them to the areas most needed in the country. Like I said, ideally not the last step in this process, but something important that should be addressed as quickly as possible. And then to respond to the final inject, transparency in terms of the simulation, and I guess in general, is very important. Transparency is an issue, whether it's in your organization at a university or all the way at the top in terms of a country's government. But when you're leading, it's very much better to be safe than sorry. In terms of the simulation, we failed to report it in a timely manner, and that really just helped this become a much bigger issue than it would have been if it had been reported when we knew about it. Also, getting the citizens to heed government advice. I know, again, we talk about the behavior that's important to address in a situation like this. But in addition to that, I think there needs to be work that is done to build the public's trust in the government, because a lot of times non-cooperation is due to a distrust of the government. And if we can help build or mend that bridge between government and citizen, it'll really help in trying to contain something of this magnitude. And then lastly is just being proactive instead of reactive. In this sense, we want all capable parties to help contribute to a solution instead of waiting and watching to see kind of the outcome of the situation. We always talk about how nobody really cares until it hits home, but by then it's too late. So cooperation between organizations, between countries is essential to help mitigate something of this magnitude.
Thanks very much. And I just want to highlight for the audience that amongst the students here represented on the panel and also in the actual scenario groups, the students were placed from different schools to be sitting not with students that had the same background. So we had epidemiology students sitting with veterinary students, sitting with students getting their degree here at the Scowcroft Center in Public Policy, I had a PhD student in political geography in my group. And so students really had to put themselves outside of their comfort zone and think about something that they weren't necessarily all thinking. And I think the group that handled China had one of the toughest challenges, and you really, because they were the affected country, which is always the hardest place to be in any scenario, and you put yourself in the fight where other donors were making decisions that had global impact on you, and you really were able to think like an affected country. What should we be doing? So I commend you for that. And I'm going to ask you my question. So what really surprised you, or what capability do you really wish that you had to bring to this fight?
What really surprised me, just in terms of how we handled the simulation, given that some of the other panel members represented NGOs, multilateral organizations, what surprised me was how little we used or we actually thought about those external organizations. Because I can tell you, not once did we think about an NGO or any kind of external group coming in to help. And I don't know if that sentiment is shared in reality at the national level, but it's definitely not something that comes to mind. There are other priorities that you have to really focus on before you think about something like that. And in the terms of our simulation, we were able to interact, but in a real-time scenario, that kind of interaction almost seems like a luxury. So what do I think we would like to have is just more time to develop that, time to actually.
It's one of the reasons we do exercises, absolutely.
But like I said, it is a luxury, and in reality, that time is just not available.
No, that's great. Thank you so much. Please, round of applause. All right, next we have group 3, and we have Thomas representing bilateral donor organizations and implementing organizations.
Hi, so I'm Thomas Snavely. I do research in the biochemistry department on infectious disease and novel treatments for that, as well as studying emergency management at the Bush School. So my group was led by Dr. Shields, and we had a very interesting blend, an undergraduate studying genetics, as well as a future Army MD, PhD, and then someone also interested in algorithms, so using computers to help track this kind of stuff. And so I thought it was a really nice blend in my group. As we moved on to prevention, I think that localized risk assessment was very important, understanding what regions, what vulnerabilities they have, and what abilities they have to respond to them. And so that's something that definitely should be done in advance. For regions that maybe don't have as much government support as we have in the US or as much structure, we want to be able to, as donor governments, we want to be able to provide them with the support they need to recognize their vulnerabilities and maybe try to head them off so it doesn't turn into an outbreak. One thing that we discussed was with the wet markets, maybe there's a way that the meat could be processed in another location or other type of isolation practices so that you don't end up contaminating a large group of people. Not necessarily a whole change in culture, but maybe some more modest modifications that can be taken recognizing the vulnerabilities in that area. As other people have mentioned, preemptive vaccination would be great. If we can get vaccines that are effective and get them distributed, that would have a huge impact. And then we also found in our group that it would be important to do proactive screening. So not waiting until there's an outbreak to try to start testing people, but maybe giving some funds so that we can start looking and trying to detect things before there's actual symptoms or sick people or it's expanded too much. But just some randomized screening and see if we can detect something in advance. But if not, then we have to detect it when it happens. So for detection, we found that high-risk populations is probably a good place to start. So for our healthcare workers or people that do work in the wet markets, doing surveillance, increased surveillance of them in advance could help with early detection. Communication is something that we also talked about a lot as being very important at all levels of this, but especially with the detection. We wanted to make sure that if people start to see symptoms, that's being communicated to their government, and then that's also being communicated to external organizations so that the surrounding governments can prepare for what may be coming. So the local population needs to know that these symptoms are being experienced, so that if they have those same symptoms, they can report them as well. And that comes to providing information. Maybe people don't know that when they have the symptoms, they need to be reporting it. And so we really wanted to try to promote programs that would inform people to respond to this stuff early on. We also wanted to provide incentives for reporting. In the case of an outbreak with poultry and it being so important to the economy, we don't want it to be looked at as we're going to take a huge economic hit. We want those regions to know in advance that there's support from other countries, and so that instead of maybe being concerned about the economic impact, they can more be focused on the health of the citizens, because the other governments are going to come in and provide support to them so that their economy isn't as affected as it could be if they didn't have that support. Also, we need to find the source as quickly as possible and identify the vectors, because if you don't know the vector, then you're not going to be able to contain it. And one thing that we could do as donor governments is provide detection methods. Some regions are not going to have the ability to have more sophisticated detection methods available. And so as donor governments, if we can provide them with those detection tools, that can prevent it from spreading to the countries that have the resources to develop that technology. And then the final thing was preventing mass congregation. So the last thing that we want to do is have a bunch of sick people all come to an area where there's a bunch of not sick people, and then everybody ends up sick. So if we can develop technology so that the detection and screening can happen in more localized areas, you don't have to deal with the transport issues, you don't have to deal with infecting people that haven't already been exposed. And so localized detection is something that these donor governments could really support, we found. For response, As I mentioned previously, we want to recognize the economic impact that this outbreak is going to have on an area and provide them support. We could purchase the contaminated goods instead of just causing them to go to waste. They can be purchased and then subsequently tested. And then we want to provide a substitute. In the case of poultry being a huge food source, then we want to provide alternative foodstuffs so that people are not starving. We also want advanced government notifications. So we want to let the governments know before the outbreak even happens. A region should know if you do have a flu outbreak that we're going to come in and support you, not, oh, you have an outbreak, here's the support we can give you, but they say, oh, we have an outbreak and we already know that we can contact the EU and they're going to provide us support immediately, and so there doesn't have to be that initial concern. They can already have relief that the support's going to show up. They just need to ask for the help. One other important thing that we really came to that I had not thought about before, but once the outbreak starts, the local populations might not know how to handle it. They might not know how to prevent the spread of the disease, and there can be crash courses. It doesn't have to be a week-long training session. It doesn't have to be very extensive, but even a couple hours of a training session or some really good pamphlets can make a big difference in letting local populations, especially more isolated groups that maybe are not as educated, providing them with a crash course in minimizing the spread could have a huge impact on preventing it from going to other nations. And finally, we want to implement an extensive system for symptom tracking and infection tracking as well. That's going to allow for containment. As we have modern technology, if it's either cell phone apps or data mining, Google searches, or screening social media, there's lots of different ways that it can be accomplished, but we should really use the modern technology to figure out where the disease is and where it's getting spread to so that it can be contained in as small of area as possible. For the final part, for the injection, what do we wish we could have done? If we could know regions that have health concerns, know where the vulnerabilities are, and then try to improve them in advance of an outbreak, that can prevent it from becoming a pandemic. We also want to provide surveillance tools. So a lot of areas have cell phones now. Maybe we just need an app, and that might be able to be accomplished through social media. Maybe we don't need another app. Maybe we just need more cell phone towers or cheaper access to cell phones, or just good screening tools for the data that's already publicly available. But that kind of stuff can be invaluable. It seems obvious, but staging and stockpiling of the supplies that we need, the masks, the antivirals, the medication that's necessary, having that in locations already so that transport doesn't become a big issue. You might have the supplies, but if they're halfway across the world, you can't get them there quick enough. And so knowing what supplies you need to have and getting them more localized so that as soon as an outbreak happens, they can be distributed would be a huge advantage. I talked about the crash course, but also it would be important to try to train local areas. With the wet market example that we've talked about, there are definitely vulnerabilities there that people know about, and so as those vulnerabilities are recognized in other regions, we need to make sure that that information gets passed down to the small localized regions so that they understand their own vulnerabilities, and that's something that we can do in advance in a slightly more detailed way, instead of just a crash course for hand washing and wearing masks or whatever it may be. So a more sophisticated educational system. And as these donor governments have the resources to develop these plans, we just need to then get that information to the people. And finally, bilateral communication and response strategies. So we want to make sure that everybody's really working together on this. Redundancy can be good, but we don't want wasted resources of everybody kind of doing the same thing. So coming up with plans, communicating, knowing in advance if an outbreak happens here, who's going to do what, so that the plan can be put into place immediately instead of trying to say, now we have an issue, who's going to do what, was a very important thing that we thought we could do to help mitigate.
Thank you so much. And a round of applause, Thomas. Thank you. that was excellent. And I think your group had a really interesting challenge of dealing with being both donor governments, but then as donor governments got affected in the scenario, having to deal with trade-offs between what was being given and what would be saved in the event of need at home, and how to handle that on a global scale, and how we need to be thinking as a global community. So I'll ask you the question, what surprised you? What do you wish that you had that you did not have?
What surprised me? I was a little surprised with the lack of maybe the way that education gets passed down. I guess maybe I feel a little spoiled in the U.S. that we have so much healthcare information available to us, and so I hadn't really considered how much of an asset it could be for us to share that information. And I think that also ties back into the way my group, or at least I personally, felt about being a donor government. We had the fortunate position where we had money and we had technology. Our goal was just, how do we help other people? So we weren't in this position of necessary vulnerability. We were in a position to help. So since we have the technology and the resources, how can we get that to people that need it, that don't have it already? And that was my most important takeaway from it, is sharing the knowledge that we have with people that don't have it already.
Thank you very much. Next, we have Madison, who is representing the non-governmental organizations and foundations. Similar situation, but from a non-governmental perspective, and very important in terms of implementation on the ground. And you can speak up. If people are more comfortable speaking at the podium, they're absolutely welcome to do that.
No, this is great.
Thanks.
Absolutely. Howdy. My name is Madison.
Yeah, howdy. I forgot howdy at the beginning. I'm getting schooled here.
My name is Madison Moore. I'm a second-year Master's of Public Service and Administration at the Bush School. I focus on counterterrorism and national security policy, and will be graduating in May. And so on Sunday, I was part of the international NGO and foundation group, focusing on the prevention, detection, and response efforts of those groups during a pandemic. Our mentor was Dr. Joseph Fair, and the rest of my team members, you can see their names up there, and you can see that we come from a host of different disciplines and departments at Texas A&M, none of which are nonprofit or foundation, and that provided a really good discussion, a difficult discussion. It was a good, challenging to have to put our feet in the shoes of other people in that. And so we did look at prevention efforts. And so right off the bat, one of the first things we said was that NGOs and foundations will play a critical role in providing and promoting education. What is this disease? Where does it come from? How do we protect against it? How do we educate the rural farmers and the people who are handling the poultry and things like that? And a big part that played into that was that a lot of NGOs already had offices in these countries and have established relationships with authorities and with different villages and people local. And we really thought that those relationships would be beneficial in this time to help educate and also to help bridge the gap sometimes between governments and between local entities and just village to village, even the scope that nonprofits and foundations can have in these countries. Also, one of the more obvious is that to utilize health systems and available labs that these nonprofits already have access to, and to use those and to use them quickly in the prevention effort. As this simulation continued, we saw it pop up in countries that had high refugee crises, and so we started to talk about that and at-risk and high-risk populations across the world, where you see high levels of migration and refugee camps with the types of living situations that those accompany. And we started to talk about the need to focus on those and the prevention efforts that would be needed to the focus in that, because those are places where really pandemics, you could see them take off and spread from a point and go across the world. And we also talked about, as a pandemic continued, that large nonprofits such as the American Red Cross would start to raise funds. And the ability to raise funds also provides the ability to raise awareness across the globe, because I think sometimes we're sitting here and we don't necessarily fully understand, the average citizen, what's going on across the world, and the ability to raise the awareness and raise the funds from an international NGO level and the framework that accompanies that. We also talked about the focus on disseminating to multiple different sectors. So foundations and nonprofits are present across the board in education and health and public sector, private, and the ability to really leverage that network and in different and new ways that we were kind of spinning ideas off of how could we use that? What kind of nonprofits would you not immediately think of that we could pull into this umbrella? And that was a really interesting discussion. And then we moved on to some of the things that we talked about with detection. So one of the first roles that we talked about would be that we would have to distribute case definitions. and to distribute information on what to be looking for, symptoms, things like that, going back to like the relationships of establishment that we have with these countries, and the ability for us to help distribute needed materials to provide earlier detection and things like that. And also the use of available labs and the funding of new rapid tests. And as we kind of started to talk about this, our group talked about in other disasters you might see the prevention stage, the detection stage, and the response stage, but in a pandemic, the three of them are really happening at the same time. And that you have to be aware of that and kind of be fighting all three battles on the same front. Another thing we talked about was the education on disease and prevention and detection, specifically in the public and private sectors, so things like wet markets or the ways that you are handling poultry and things like that, and the education aspect that can come into that. If there's small things that you could maybe focus in on practices in these industries that could help prevent and detect earlier on their arrival in countries. Another thing that we talked about was the engagement with governments to offer epi-modeling and data analysis. And in that conversation, likewise, we talked about tech billionaire type of things. You see the Elon Musks, the Bill Gates of the world, they have foundations, and in prior disasters, you've seen them provide funding, tech, resources in those situations. And we kind of spun the idea of what would that look like in this situation, and the ability for them to gather data and fund analysis and research. And also with, like you see with Google, tracking symptoms with people Googling them and then them showing up later on. So then in response, one of the things that we talked about was to teach the best practices for reduction and the roles that nonprofits and foundations can play in that, and also direct interventions for the nonprofits that do have the ability to directly medically intervene in these pandemics. Another thing we talked about in this simulation, we proposed a 5% GDP reduction, which is a really significant reduction, an economic hit. And so we talked about the financial support for human and animal life that would be needed and that nonprofits and foundations could provide. We also talked about social mobilization, whether that be through organizational outreach campaigns, religious entities, and the ability to really increase sensitization to the pandemic and how to stop it and be able to get ahead of that in that manner. We talked about the relief services provided by nonprofits and foundations as well, whether that be psychosocial, nutritional, et cetera. And then one of the things we also talked about kind of later on in our discussion was biosecurity and the need for safe disposal of corpses and biohazard training, and not just the training, but the use of and the accountability of those things, not only as a prevention tool to mitigate unintended exposure, but also the environmental impact and the malice use of those things by rogue states and terrorist organizations. And we thought that that was an important aspect to focus on in the response. So for the final inject, the question about what do you wish you would have done prior to this, a couple things that our group talked about was that we wish, like many of these have echoed, that we hope the government has a plan in place, and not just a plan, but resources and supplies and pre-staged where people know what they're going to do, where they need to be, what needs to happen, and not just in the United States, but across the world, and that we would, on the day that you needed that people would understand where they needed to fall into place and take action. And that these plans were tested and that they were known and understood. And likewise, something that our group really talked about in this aspect was the ability to communicate to the public that there is a plan. It was one of those moments where we kind of said, if I'm today in a burning building, I know who to call, kind of like what I can do to best help myself, who's going to come help me. And then we talked about if tomorrow a pandemic happened, none of us could tell you what I should do, where I should go, or who was going to come help me. And we kind of talked about how education is empowerment and how that could really help mitigate fear and panic in a situation if the public had a really base knowledge of those aspects of that. And so along those same lines, we talked about early warning systems and cooperation, and also the sharing of samples and data and vaccine candidates really early on. And the cooperation, I think that was something that we all kind of were surprised about, was some of the lack of cooperation at times. And then also one thing we talked about was money. Everyone loves money. And so we talked about contingency funds, and we talked about pandemic insurance and those things, and we understand that preemptive funding and to put that in place is not everyone's first priority all the time, and it's hard to relay the need for that, but we were asked what we wished for, not what we did. And we said that in retrospect, we wish we would have put more money aside, and that for contingency funding for not only just for the loss of life, but the economic and nutritional aspects, it goes on, that we wish we would have done that even for a low probability situation. And in that same kind of strain, we talked about supply chain integrity, support and alerts, and we answered these questions kind of not just from the international NGO standpoint, but we answered this final question, just all of us overall. Supply chain integrity, we lived in a globalized economy, and we talked about, there's a goods made in one country, it's altered in another, and it's consumed in yet another, and by the time it reaches your kitchen, many hands have touched it. And one, that being a vector for the transmission of pandemics, but also if a country were to not be able to produce the goods and services that they normally do within a supply chain in a globalized economy, what that would do, the fallout from that, the secondary, tertiary consequences in other countries, and are we really aware of that? Do we really understand what would happen and where these goods would come from and what other goods the loss of those services could impact? And then I think the last thing we talked about was that we wish that we would have conveyed to the public that this was an inevitable problem, that it was going to happen, and that we would have conveyed to the public more education, just that it's not only but if but when, and that that's important, and that they should understand the base ground for this, and while they understand it, not fear it. And the empowerment of education was a big thing in our group, and we think that, especially from the international NGO and foundation level, that they could play a really critical role in that.
Great, fantastic. So what surprised you?
I think what surprised me, and I've been sitting here thinking about that, is that whole afternoon no one got up from their table and walked across to another one. And we just got our questions and we sat there and we brainstormed and we wrote them down and we got up and we spoke about it, and then the situation changed, we went back to our tables. And no one got up and went across the room and said, what can I do for you? Or how can I help you? And I think that surprised me. And I've been in simulations in the past where that was more of a focus or less of a focus, and no one ever got up. I didn't meet a single person from another group. And I think that was a thing that I really took away from it, was that I hope it's not like that in reality. But in that afternoon, I never left my table. And so, yeah.
That's great. Thank you so much. And last but certainly not least, we have Jennifer, who is representing the group that I had the privilege of mentoring, representing the U.S. government, often the big elephant in the room.
I am going to stand because I'm a mover, not a sitter. So let me get that.
I'm going to take your seat. Yep.
Yes, absolutely. Okay, so yes, my name is Jennifer Reinsmith-Kranz. I'm a PhD student in the Department of Entomology. I study diptera behavior and concepts related to forensic and medical entomology. And again, we represented the United States government. So one of the things that we focused on, especially at the beginning, is that the United States government is not a discrete entity, right? It's made up of multiple organizations and sectors and agencies, which may or may not always agree on the right priorities, approach, or even the problem at hand when something like this happens, right? So one of the questions that we asked ourselves and that we asked Dr. Cameron was, well, who's in charge, right? And the answer is, depends on who you ask, right? But really, it kind of depends on the administration and the president and kind of how that falls out. So there really isn't a set agency hierarchy in this situation. So our first question on a kind of myopic level was, at the beginning at least of this simulation, the pathogen, the disease, had not arrived in the United States. And actually, it didn't arrive in the United States until the very last inject, really towards the end of the day. So we spent most of the day talking about prevention and support. How can we support these affected countries? So when is it coming? How can we stop that from happening? And then how can we support the countries where it already is and where it's already established and they're already affected? So before we moved into actual preventative measures, there were a lot of different things we considered as a group. So we looked at trade and travel, both in and outside of our country, as well as contiguous countries, so talking about Canada and the South American countries as well. And one of the big things we did is every time we had to make a decision, talk about a policy, anything we did, we really considered the effects that the decisions we made would have, not just on kind of a political and health standpoint, but also on the private sector, right? What is this doing to supply chain and private companies and profits and all of these things that kind of these cascading decisions can have, right? And then also looking at the health and safety of obviously our American citizens, not just in the continental United States, but also the thousands of Americans that live and work abroad and who may already be in these affected areas. And considering what we can bring to these affected areas since it hadn't quite arrived to us yet, right? So in terms of physical resources, infrastructure, professionals, right? So people and educated professionals that we can be deploying to help there. So the pros of that, right, in terms of supportive care, but also some of the risks associated with that. So looking at responders as vectors was something we talked about, right? So we're deploying these responders, and are they then bringing it back when they come home as well? So when we moved into kind of actual measures that we were looking at, so the first thing we did is we began with a travel advisory. So we decided very early on that we did not want to close the borders for a number of reasons, not the least of which were international relations and the effects on supply chains, which we've talked about, both the public and private sector as well. Mobilizing professionals, so again, getting our educated professionals, epidemiologists, emergency preparedness teams to go where they were most needed. And then also focusing on some diplomatic outreach. So we've talked already, some of the other groups have talked that in the beginning there was maybe some under-reporting and under-regulating going on when this was first starting to spread. So really focusing on using diplomatic outreach to reach out to those affected countries and really encourage reporting and regulation as we move forward. So as we moved through the simulation and we got more information, one of the things we requested was that we wanted a sample of the pathogen so we could begin developing our own vaccine. And it was actually at this point that not talking to one another was really interesting, because at this point we also found out that the China representatives had developed a working vaccine, but that they were concerned at the time that they wouldn't maybe have the infrastructure or the manufacturing capacity to maybe disseminate that, right? And so one of the things we said, we were open to the conversation of using that vaccine and using our American infrastructure, pharmaceutical professionals, whatever it is, to kind of help distribute that vaccine as well. Travel screenings. So this is actually where we spent the majority of our time talking, I would say the whole day, was talking about travel screenings. And when we say that, we're looking at temperature screens, so fever screenings, and kind of looking at that. So we looked at several different things. We talked about the efficacy, right? A temperature doesn't necessarily mean that they have our pathogen. And for this particular pathogen and this particular strain, are they shedding that virus before they're even presenting with a fever? So how efficacious would this travel screen even be? The feasibility. So where are the screens being done, right? Are they being done upon arrival in the US for travelers? If so, what are we doing with those that present with fever, right? What is our quarantine policy? How do we enforce it? Who pays for it, right? And so we definitely had a lot of those conversations as well. And then lastly, the tangential effects, right? And so this was actually something we came back to a lot. So as we made decisions, how does this affect? So in this specific example, how does implementing these travel screenings affect the airlines or any of the other travel agencies, right, that are going on? And then finally, looking at a distribution of preventative information. So using the information developed by the NGOs and by some of the other organizations to basically just create a less susceptible population, right? A more healthy population, so that if and when that pathogen did arrive, we had less people who were maybe immunosuppressed or immunocompromised and then susceptible to that pathogen. Moving into detection, so again, travel screenings were really both part of prevention and detection, but we can also consider the resources we have in terms of people, right? So again, looking at virologists, epidemiologists, pharmaceutical infrastructure, pharmaceutical professionals to assist in developing a rapid diagnostic technique. And also collecting information on the flow of people in and out of the country. So again, how efficacious are those travel screens, right? They're not 100%, certainly ever. So as people come into our country, because we decided not to close those borders, how do we track what's happening, right? How do we track infected individuals that may come? And to do that, we really got the hospitals involved. So really distributing some of those case definitions from the NGOs, looking at really getting a list of symptoms, mandatory reporting from the hospitals on red flag symptoms or red flag travel, making sure we're collecting that travel information as well. And then moving into response, so again, up until the very end of the day, the very end of the simulation, most of our response was preventative because it hadn't arrived. So we were looking at preventative measures, and I won't go through all these, I know we're short on time, and a lot of the other groups have talked about these, but looking at things like assisting in vaccine development, things with travel, diplomatic outreach, but one thing I would like to touch on that our group actually didn't initially think of, but another member of another group brought up, was we were very focused on the movement of people, right? And people moving in and out and the pathogen entering that way, but also considering the wildlife, right? As vectors, reservoirs, or hosts themselves, right? And so we started talking about the migratory bird populations, right? And both as a pro and a con. Obviously a con is that is a way where that pathogen can enter our country, but also as a pro, because something we talked about was maybe not having access to the information we needed, right? Whether that's a sample of the pathogen, being able to study this if countries weren't working together at the time. And so using that migratory bird population, if the pathogen did arrive, would be a way in to kind of get access to this pathogen and start our own development and our own data generation. And then last, of course, not just prevention, but palliative care, right? So looking at mobilizing our professionals, we talked about sending, obviously, healthcare professionals, but even looking at the National Guard, right? So if this is supposed to be modern, right, this is happening in 2018, 2019, DoD is a little occupied, right, with what they've got going on already, and so looking at mobilizing National Guard units and things like that who are emergency prepared and are prepared to respond to these crises. So then the last question, obviously, what do we wish we could have done differently? What do we wish we could have had different? So as a lot of the other groups have said, having standing policies was a huge, huge thing we kept coming back to. I would say we spent 90% of our time discussing what policies we would create and very little time getting to talk about how we would implement them, just because there were none. So a really good example of this would be the quarantine issue, right? So talking about the travel screenings, and after talking with Dr. Cameron and some of the other mentors, we kind of figured out that there's no standing quarantine policy, not really, at least in our nation, right? And so what do we do about that? And we spent some time talking about Rebecca Katz's work in shifting the culture of quarantine, right? But this is a bigger issue, right? Not having these standing policies in place means that when a crisis does happen, we are under a time crunch and a pressure crunch to really develop these policies quickly so then we can go implementing them. So having those policies in place beforehand so they're there to implement when the crisis happens was huge. And then again, communication. So going back to what we were saying about communication, there are obviously political pressures and things that happen all the time that change how we communicate internationally, right? And so one of the things we talked about that it would be great if there was a way to do this in a more private sense, or not behind closed doors necessarily, but a way to open a line of communication between governments that was secure, and so that we could start handling this crisis without having to constantly mitigate kind of some of these outside pressures. And then continuous development of science and technology. So I think a lot of us that work in science or just work on grants in general know that in a crisis, the motivation and the money is there, right? It's there. But when we're out of the throes of that crisis, that motivation and that money can dry up, right? And so really just keeping this as a constant source of focus, right? So that we have these things in place when the crisis happens. Same thing for data collection. I won't touch on that again since several other students have. But we actually considered a different side of that data collection as well, which is as we generate this data, whether it's from social media, search engines, whatever it is we're talking about, what's the opposite end of that issue, right? And so these privacy issues that we talk about, who gets that data, right? If we're generating it as the United States, is that our data? Is this something we're doing internationally? Does that data then go to the UN? What do we think about the privacy of that and kind of the potential for malicious intent by anyone, right? And yes, so I will hand it back over to you, Dr. Cameron. Sorry, I moved a little quickly. I know we wanted to get to questions, so thank you.
What surprised you?
So a big one for me, obviously, was the standing policies, and there were so many things as a group. So again, we had a mix of like science, policy in our group, social sciences, and there were so many times where we thought, oh, there's an answer to this question, and we would turn to you and say, you know, what do we do in X situation? And Dr. Cameron would be like, there is no standing policy. What would you do? You tell me, right? And so that was.
I was having flashbacks. No, that's great. And I just want to give the panel a round of applause one more time for fantastic, not only fantastic work, but fantastic presentations and wrap up, and really thanking the schools here and all of the sponsors for making this possible. I know we're short on time. Do we have time for one or two questions? What's the call? Okay, great. So if folks have a couple of questions, please come up. We did want to give an opportunity, since this had to do with H7 and 9, to ask our colleague from China CDC if she had anything that she wanted to say. I know we talked in advance quickly. A lot of what I heard on Sunday really resonated with me when I heard what was actually going on. But just because I think it would be great for the students to hear from you actually dealing with this pathogen in real time on the ground.
First of all, I would say congratulations, groups. It's a fantastic work for you, and since you have different background, and since the representative of China, you barely know, maybe not too much for our country. And so since I'm here and I was requested to share some my thoughts about the simulation or think about the pandemic preparedness in China. Actually, I think according to your presentation, I think there are some hypotheses or the scenario simulation for your work. And I didn't see that material, but according to your sharing information, I guess there are some gaps between your scenarios and with the reality situation in China now.
Yes.
So it's my responsibility to share with you some reality facts there. And according to the first two groups, I think currently in China we have already established a surveillance system. Is timely and 24 hours, and it's internet based, and we're covering all over the country from the big city to a remote area, a village. And we also have good collaboration with the external organizations, for example, WHO or FAO or OIE or even CDC Beijing office. that is very regular, and we have a regular risk assessment meeting. We have a regular information sharing, and for example, our influenza surveillance report, the weekly report, regularly shared with CDC. That's without doubt. And for our National Influenza Center in China CDC, it's already the 5th WHOCC. So as you all know that. And according to the action after the outbreak occurred or potential pandemic occurred, I think for the China's government or for the China's healthcare system stakeholders, we will definitely play the role, and we will do according to our protocol, because we already have the pandemic preparedness and response plan. It's established in 2005 and developed and updated in 2012 after H1N1 pandemic. And of course, we will continue to improve it and update it. And so definitely we will follow the protocol, and we will do the control, and we will do the prevention. And regarding the last three groups, it's really surprised me, and I would say thank you very much for your groups, and also for the Bush and the Best and all the mentors, because the last three groups really inspired me for the China's pandemic preparedness. There's maybe some limitation or gaps we need to think about it. For example, the bilateral and the organizations or NGOs or for the other funders or NGOs and even US government, what you think and you plan to do, it really teach me and let me think more about China's government should be prepared for the pandemic response. So finally, I would say this is an amazing simulation, and again, congratulations for all of your efforts. Thank you very much.
Thanks, and it really struck me that this is the kind of thing that we should be doing not only with university students here in the US, but with global students around the world. David.
Strong work. You all took the simulation very seriously. You took your synopses and putting the information together very seriously. It was really, really fun to watch. I wonder, you've now done this, watched things evolve. I'm curious what parts of this work, to follow on Dean Parker's comment about hopefully you'll take our jobs, what parts of this simulation made you say, wow, I would love to get involved in that aspect of risk mitigation or risk management in emerging diseases, and what parts convinced you that you were right to study Diptera? I'm curious what you all thought about that.
Who wants to jump in?
I can. I guess I've been extremely motivated after coming to this conference as a medical student and got my head in the books, learn challenging, and so kind of coming up for air and experience this tabletop exercise where we are divided up into different organizations and different entities, and seeing how those interact with each other, and then learning at this conference, especially yesterday with the discussion on leadership and kind of reflecting back on the 1918 experience and what we know about that and how we've applied that to what we're hoping to prepare for in the future has been a very motivating experience for me. I'm very interested in infectious disease. This started kind of back when I was in college and I took my first global health course. So I think that I'm just further energized by the experience of this tabletop exercise and learning from my colleagues here at Texas A&M and from you all that have sat on panels and asked really thought-provoking questions.
Does anybody else want to jump in? I don't think we have any more questions, so this will be the last. And please, jump in, Madison.
I can jump in.
Thanks.
So I think for me, I study national security at the Bush School, and I'm really passionate just about the protection of people. And that's a big role in pandemics. And so for me, it really aligned with a lot of what I like to do in study and what I'm passionate about. And I think for me, a big part of it is in studying terrorism policy and things like that, and security issues, bioweapons and chemical, biological, all those things are a big role. And just pandemics, whether they start naturally or they're weaponized or things like that, I think it was really good for me to see the different actors that played a role, because I think so often we talk about it in class and you study it and you read books, but I think for me it really opened my eyes and helped me to say that I needed to have a more holistic understanding of that, because in that type of disaster, the roles that would be played and the actions that would need to be done all at the same time are really kind of unique in a sense that it's not the same type of emergency management response that I study every day of just like, okay, something has happened, how do I respond, but how do I respond and combat it all at the same time? And I think that was really good, and for me it really opened my eyes to just how closely tied it is to what I study, and how maybe the overlap of disciplines could be greater, and how, you know, if I'm sitting at the Bush School and I'm studying national security, why don't we have classes where we have mixes of national security, epidemiology, and things like that, so that we may better understand in the future and have that basis, and don't have to in the moment say, oh, I don't know anything about this at all.
Yeah.
And so.
Yep. No, I think we have time for each of you to jump in quickly, so feel free, Jennifer.
So I was just going to go off of that, and that, again, a lot of my work in forensics, we know it's very multidisciplinary, right? So the scientists interact with law enforcement, interact with the judicial system, and that's what I was most interested in this simulation, is to see how all of these things interact. But I will say that one of my biggest takeaways was, I think as scientists, I'm going to speak for the scientists in the room, sorry, I think a lot of times, you know, we have this science and we feel like people in policy, like, they just don't understand our science. Like, why can't you just understand our science, right? But my opening experiences was, why can't I just understand the policy? Like, I have this science, and I was woefully unprepared for like how complex that is. Like, I know it's complex, but to see it in practice from a scientist's point of view was definitely eye-opening for me.
Yeah, for me too when I entered government. So it's the real world.
Absolutely.
Yeah.
I just kind of want to echo on that. As with my background in epidemiology, I'm very used to being the boots on the ground, the person doing, quote unquote, the grunt work. So like you said, it's very frustrating sometimes to be like, why can't we just do it X, Y, Z? Like, it's very simple, it's on paper, let's just do it. And you don't have that view from the top. You know, there are people that are moving pieces, and it's not just as simple as being able to do X, Y, Z sometimes. So being able to see the way the pieces move from a policy point of view really helps me understand what goes into making the decisions that allow me to move, and also just have patience maybe with the people who are making the moves, and not just get frustrated that, you know, you're really holding me back here. Just let me do my job, and, you know, there's a system, there's a way to do things, and I just have to be patient.
For me, while curing and preventing some of these diseases would be great, this was a really eye-opening simulation for me, because I think it made me realize how much potential there was for a humanitarian impact. And so that's motivating for me as I continue with my career, realizing how much of an impact we can have. And so I'm just looking forward to trying to do that in the future.
Yeah, so before we give everybody a round of applause, anything else that you guys left off the table that you wanted to tell these guys, who the current leaders from the future leaders? Anything else you want to say?
I would just want to extend a sincere thank you to everybody at Texas A&M putting on the conference and particularly putting on the simulation. I know everybody in my group was very invested in our entity and was a very wonderful learning experience and really challenged us to think outside of our normal realm. So I just want to thank you.
Thanks. Well, on that note, I want to thank all of you because I learned a tremendous amount. I know we all did, and just thank you for tremendous work. And you were all asked to stay engaged. So I hope that all of you and everyone in your groups will stay engaged. And if you need to reach out to certainly me, the organizers, or I think anybody in this room, please do.